from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about screen time injuries and ways to prevent them. To begin our conversation, we're joined by Dr. Stephen Papuchis, a physiatrist at Sarasota Memorial. Dr. Papuchis, thank you so much. It's been a while, so thanks for joining us again.
Yeah, happy to be back.
So Dr. Papuchis, technology and screens like phones and tablets are part of our everyday lives. In fact, people listening or watching this right now are probably doing so on a screen. But technology can also hurt us physically. Can you start by talking about some of the most common injuries you see from texting or too much screen time?
Yeah, so what we are seeing a lot more of now as technology has advanced and time has progressed, back in the early 2000s, there was that initial switch, and now we have a much more technologically based society. A lot of work is done on a computer. You have people who take meetings and do emails on their phones all of the time. And so what we see a lot of is this. People hunched forward, constantly looking down at their phone, hand constantly, contracted just to hold their phone. And so we see a lot of neck issues and back issues and even wrist and hand issues that come from just overuse of that technology because it's become such a big part of our daily life.
So I looked up some of the nicknames for some of these injuries, and I want to break down with you what these are. Let's start by one of them you just spoke about, text neck.
Yeah.
What is that? What causes it? And can it be reversed?
Right. So tech neck is kind of a general umbrella term for a variety of different neck issues or pain syndromes that can develop because of the posture we take when we're working on a computer or on a tablet or on a phone. And so what a lot of people do as their day progresses, they work a desk job and they're sitting for 6, 7, 8 hours at a time, is they slowly go from this, again, down here like this. Their head comes forward, it becomes unsupported in front of their spine, in front of their body. And all of these muscles on the back part of their neck and on their shoulders, they get overstretched. Their upper trap muscles get really tight and contracted. Their pec muscles come in and round forward. And imagine sitting here like this, again, for 6, 7, 8 hours at a time, just answering emails or getting, phone calls, things like that. So what happens is these muscles become stressed. They become tired. They can spasm. As you get older and everyone starts getting arthritis, you're putting stress on the arthritic joints that develop in your neck or in your shoulders. And all of these things can contribute to a lot of really significant pain. And so the way that we deal with that is trying to reverse all of that. And so when you come in to see me in my office, if you're having pain and you have all of these factors, we can prescribe to a variety of different things, whether it's physical therapy or medications or just adjustments in your ergonomics, which is a big fancy term for your work setup, that can help offload these structures and ultimately help reduce your pain with time.
There is also something called text claw, which sounds terrifying. What exactly is it? What causes it? Talk a little about that.
So similar to tech neck, it's kind of an umbrella term for hand and wrist issues that develop for people who are just constantly holding their phone. Most times it's with a death grip or, it's like they're maybe really stressed because they got a deadline and emails to send. But it's overuse of different structures in your hand. And so some people can get cramping in the muscles. Some people can get what we call trigger fingers, which are buildup of tissue in some of the flexor tendons that cause your fingers to kind of catch. Again, over time, as your hand develops arthritis, just using these smaller devices and constantly gripping them can cause pain. If you're just typing at a computer, so maybe not necessarily text claw, but again, a lot of typing, you can get nerve injuries, whether it's an ulnar nerve injury or your median nerve injury, which is most commonly known as carpal tunnel. All of these things can come together and contribute to discomfort, numbness, pain that you develop in your hand that we can affectionately call texting claw.
And I know that it's not even just hand and wrist. It can even move up into elbow and shoulder, correct?
If, again, it's depending on what your positioning is, underlying biomechanical factors, other, age-related degenerative processes, you can develop pain in these various different areas. And it can be really debilitating for some people. It can get to the point where it allows them to, or I should say, doesn't allow them to complete the functions of their job. It can affect them at home, taking care of like the dishes or cleaning or just getting dressed. So, these can spiral out of control and become really big deals to a lot of people.
So when we were talking about text claw there, You mentioned a number of different things that I hear a lot. So can you explain the difference between like trigger finger or carpal tunnel? What is the difference? So people don't think they have one or the other.
Sure. So those are very specific diagnoses to
Okay.
describe different things that can happen in your wrist, your hand, your arm. So trigger finger, again, affects the flexor tendons of your finger. Most commonly these guys in here, but it can happen to any finger. And it's just a buildup of tissue in the flexor tendon. There's a structure called the A1 pulley in there, where when you bend your finger, the tendon gets caught in this buildup of tissue and it doesn't allow it to come back. You can physically feel a little ball that's there. And so some people have to move it. Some people, they have just to wait and they can finally get their finger to disconnect. And it's a trigger, kind of like you're pulling the trigger of a gun or whatever you're doing. Whereas a carpal tunnel syndrome is a nerve injury. It's the median nerve as it comes through this part of your wrist, what we call the carpal tunnel, carpal being wrist bones. And this area is a place that can get really tight, it can get really inflamed, and all of that crowds that nerve. And if that nerve gets irritated from the crowding or overuse, you can start getting numbness in your hand. You can actually get weakness because the muscles they innervate stop getting the juice to tell them to do what they need to do, and so you can get weak. And so these are all different things that can happen as part of this overuse injury pattern from technology and overusing these devices.
And how do they differ from like tendinitis? And can tendinitis be an issue that comes from some of these overuse?
Tendinitis tends to be, again, another type of overuse issue that affects the tendons. So they're all similar in the sense that they can come from overuse and stressing these different structures. It's just they're different structures and they manifest symptoms slightly differently depending on what's being irritated.
So where does tendinitis most commonly occur in relation to these screen time texting injuries? Like where do you see it the most?
So you can see it, again, it just really depends. It depends on what you're doing, maybe what your job is. Again, if you're typing a lot and you have your wrists kind of cocked up all the time, you're constantly firing what we call the extensor compartment, these wrist extensors and finger extensors, and you're typing a lot. Well, a lot of these ligaments and tendons are constantly being used, and so that can generate a tendinitis. So again, it's typically an overuse injury. Maybe there's a little bit of impingement. For some people, like common is a shoulder tendinitis. Maybe not necessarily technologically driven, but it's something that you can understand. It's like, hey, I'm using my shoulder a lot. I'm reaching up. I'm constantly carrying things, and man, now my shoulder is getting sore. Well, that's a rotator cuff tendon issue, and you can get tendinitis from that.
Understood. We know that many people feeling joint pain of any kind, whether it's their hands, their wrists, their elbow, whatever it is, they're going to visit an orthopedist. But they're often then referred to physical therapists or a physiatrist like yourself. How can physical therapy help with these issues?
It's all about biomechanics and your ergonomics. It's all about the setup, all about seeing, okay, how is your body moving? What stressors are being applied through these structures to kind of identify what's the underlying kind of root cause of why you're getting these issues, and then coming up with an exercise regimen to reverse all of that. So again, for something like tech neck, our shoulders elevate, our pecs draw forward, you lean forward, and you see what we call this upper crossed posture. It's an X. You get a tightness up here and down here. You get weakness in your deep neck stabilizers and in what we call the posterior chain, those long, thin muscles that go up and down the spine. So physical therapists will help identify these things and come up with exercises or stretches to reverse that, building strength and stability with these deep neck stabilizers and that posterior chain, stretching out your pec muscles, stretching out your upper trap muscles, and doing this consistently and repeatedly over time can help reverse some of the postural abnormalities you develop and ultimately reduce your pain. And so physical therapy is an incredibly useful tool, and I found it to be essentially the foundation for almost everything I see in my clinic. We need to do things to help reduce your pain, but ultimately it's the physical therapy and the exercise that you're going to do to work on your biomechanics that's going to give you long-term success with these issues.
So depending on the injury, someone might be referred for physical or occupational therapy first. Why do you recommend attempting physical or occupational therapy first before you start going into pharmaceuticals or even surgery in severe cases?
Yeah, because most of the time, I would say 90% of cases, you get a little TLC with your occupational therapist or your physical therapist and things go away. And so it's a very simple way to deal with this and reduce your pain. Plus, it gives you some tools. So if this stuff comes back, so again, you work at a desk job, you have to be on a computer 6-7 hours a day. Well, you're setting yourself up for possibly recurrent injury. Well, if you know what to look for, you know the tools that you have at your disposal, you can get up throughout your day and do some simple stretches. You can put this in an exercise regimen for your overall health to focus on, hey, I need to maintain this up here so I can do my job and not be miserable at the end of the day because things are tight and sore and you're having pain. So these tools are extremely useful, but they do require a little bit more effort. So I think some patients tend to gravitate towards, hey, if I can just take a pill, it's 2 seconds out of my life to swallow something and then I feel better. Okay, that might work, but those pills have side effects. They have long-term issues that we have to monitor for. Sometimes they don't work as well over time. Your body changes, you get older, you get different disease states that come up, and now it's like, well, we have to come up with a different solution. So if you haven't addressed the biomechanics and your posture and strength and conditioning, you might be missing a huge chunk of what's going to give you long-term success without the need for injections or pharmaceuticals or hopefully surgery.
And if physical therapy doesn't work for patients, what are especially in relation to these sort of screen time injuries, what are the most common steps? Because it's not just everyone needs surgery.
Right. So if you come into my office, we do a big evaluation, we talk about the exercises, and sometimes just tweaking the exercises in and of itself is enough to work really well. But let's say we've done all of that and things still are difficult. You're still having pain, or you have such severe pain you can't even get out of the starting blocks in therapy. It's like, I need something to calm things down. This is where medications and injections could be useful tools in facilitating that. So for me, I like anti-inflammatories a lot. Things like ibuprofen, things like Aleve, those are drugs that I think work really well for these type of injuries because a lot of these injuries create inflammation. The problem is a lot of our patients here tend to be a little bit older. They have heart issues or kidney issues, and so anti-inflammatories aren't good drugs for those. So targeted injections, where we're putting some medication directly at the structures that are causing your pain, can be very powerful tools. They limit systemic effects or body-wide effects, and they're more direct in terms of their treatment. So when you take a pill, it has to be digested. The medication effect goes everywhere. Whereas a targeted injection, whether it's just with anesthetic or with an anti-inflammatory or with an orthobiologic like platelet-rich plasma, those go directly to the source of what I think is causing your pain structurally and can help reduce that pain fairly quickly. And then we can get you into physical therapy or your exercise regimen and move forward with that.
So you mentioned the older population. It used to be that you didn't associate the older population with technology, but these days it seems like everyone is using it.
They are very technologically advanced. Our older population, the people that live in Sarasota especially, a lot of my patients come in and, I mean, remember it was in the early 2000s where the technological revolution really happened, where everyone had a computer, everyone had a BlackBerry and then a smartphone. And so this is the same population that was prime middle of their career adapting to that changes, and now they've carried all of that technology forward. So they use a lot of technology in their day-to-day life. And so
even if they're retired.
Even if they're retired. No, everything that you need nowadays is facilitated by pieces of technology. And so I see these injuries in a lot of these patients. And so yes, they do use a lot of technology.
And you're also seeing the injuries in younger and younger patients.
Oh, yeah.
Obviously, everyone has a cell phone now. Everyone is using a computer.
Most schools, they give you a laptop for your books and to do your work in class nowadays. And so, yeah, a lot of kids are using this and we're seeing this. And so it's really important to stress that you have to have scheduled time off of these devices. You have to have time to put them down. And it's not just for physical stuff, it's for mental well-being. Get outside, get in the sunlight. You have to move. Our bodies are designed to move. And when we're more and more advancing in, our day and age of everything through technology, people are becoming more sedentary. And so you're seeing these injuries, you're seeing these pain phenomena that are coming about because people just aren't moving. You're stuck on a phone for 12 hours. You get home from a long day of work, and I'm guilty of this too. You just want to sit down and relax, and next thing you know, you've been doom scrolling, as the term goes, for 4 hours. And it's like, oh, it's 10 o'clock and it's time to go to bed, and I haven't done anything for the last 4 hours since I've been home.
Right.
And so, it's everybody. This is impacting all types of people from, I see it in 20-year-olds, I see it in 80, 90-year-olds. And these are very simple steps that we can all take to try to prevent these things.
Does age impact the severity of the injury?
Not necessarily. I think you can see people who are older, they tend to have more arthritis. Arthritis is a degenerative process. It's just the wear and tear of your joints, and it happens to everybody. And there are some things you can maybe do to mitigate that. Again, maintaining a good weight, exercising, eating a balanced and healthy diet, avoiding cigarettes, tobacco products, avoiding alcohol, all of these things you can do to help optimize this. But mom and dad and genetics play a role. And so there are some people that develop more arthritis than others. All of these postural things that we're talking about, being hunched over, using your phone a whole lot, people who have more arthritis, I see have more impact from these injuries because not only are you getting the muscle side of things, the joint's worn. And so you're putting a lot of stress through a worn joint, which can create a lot of pain.
We've talked about a lot of things. What do you recommend is an easy step that people watching or listening to this, likely on a device that we're talking about, can do to avoid having to come to your office?
Yeah, I think there's two big things, and we've touched on them a lot throughout our talk so far. One is looking at your ergonomics. What's your setup? Make sure that if you're on a computer or you're on a device to do work, get it at eye level. Get the screen right here, nose to eye. That's the middle of the screen. If you have a keyboard that you're typing on, get it down here. Think of the rules of 90. Arm down to elbow, down to wrist, everything's at about 90 degrees. The problem is if you have a laptop with the screen and everything's connected, so maybe you need to get a detachable, like Bluetooth enabled keyboard so you can sit the laptop up here while putting your typing, down here, and that's going to set your body up for a good posture. And then the other part is you have to move. So if you're, again, at a desk job, at least every hour, set a timer on your phone and take 2 minutes to get up, walk down the hallway, do some stretches, reset, and then sit back down and get back to work. It's not going to impact your job that much. And if you have a boss that's telling you it is, tell them the doctor disagrees. And you just got to move. You have to exercise every day. You have to cut out time in your day to do dedicated exercise. So the movement in between can help maintain, but you have to exercise every day, some kind of movement, to walk, lift some weights, stretch, do something to challenge your body a little bit, because humans are designed to move. We're not designed to stay seated all of the time.
All right, well, doctor's orders.
Yeah.
Everyone tell your boss. We heard it here. Dr. Papuchis, thank you so much for joining us.
Of course, happy to be here.
For the next part of this conversation, we're now joined by SMH occupational therapist Regina Bonning. Regina, thank you so much for joining us.
Thanks for having me.
We just spoke with Dr. Papuchis about some of the most common injuries from screen time. How can physical and occupational therapy help?
The first part, when someone comes in to see us as a patient, or if an employee stops us, if they're coming in, if they're injured, we try to look at how much screen time are they on, what is the cause of why they're coming to see us.
And if someone was referred for PT or OT due to something like tendonitis, trigger finger, tech neck, whatever it is, can you clarify which injuries go PT versus OT? Might they do both?
In our institution, at SMH, under the musculoskeletal realm, primarily occupational therapists will treat hand, wrist, they will treat elbow injuries and shoulder injuries. Our physical therapists, they're very capable of doing that as well, but they primarily will treat any spine injuries. They also treat shoulder injuries, and they also treat elbow injuries. But what we try to do is get the patient in as quickly as possible. But again, primarily occupational therapists will treat your hand injuries, your wrist injuries. They will also treat elbows and shoulders, and PT will also treat elbows and shoulders.
And that's the benefit at SMH of having PT and OT together. You guys can really consult and work together, right?
Oh, absolutely. We definitely have a team approach, view. And I think that's for all of our clinics.
So you work a lot with especially these hand and wrist injuries. What do you see most often? And how do you help your patients work through these sometimes seemingly unavoidable injuries because technology is in everything we do?
So I will see a lot of wrist fractures, whether they are operative or non-operative. I also see tendonitis from wrist tendonitis. elbow tendonitis. I will see trigger finger, sometimes carpal tunnel, and sometimes we will see just sprains and strains, and we're really not sure exactly what the cause is, and that's when we have to go digging a little bit deeper. We also treat rotator cuff injuries, whether they are non-operative or operative.
So if a patient comes in stating they use a lot of screen time, whether it's at work, at home, however it is, and you're seeing some of these tendonitis, trigger finger, what does OT look like for that patient? What's sort of the process?
So my first question usually is, do you know what caused this? And sometimes their answer is, I don't know. So we will actually go through, during their evaluation, we'll go through the process of, well, show me how you look when you are on the computer or when you are on your iPad, and we'll talk through that. And then after that, we'll actually go through the phases of testing them objectively, whether it's range of motion, manual muscle testing, grip strength, coordination, and then set up a plan of care with the patient at that time on how we're going to get them better.
What are some of the most common exercises and things people can expect to do during OT, maybe with you, or what does that appointment look like?
Generally, the first one is the evaluation, but we always try to send home some type of home exercise program with the patient so they can jumpstart. If, depending on what their diagnosis is, I mean, it can be a wrist injury, but you can be guaranteed we're going to look at the shoulder because everything is connected. And we will give them stretches. We want them to start being able to move properly. That's the key, is reestablishing proper movement, because what will happen if one body part is hurting, they may compensate with another body part. So we have to really look at what's going on and why is it going on.
So the word of the day that Dr. Papuchis brought up is actually ergonomics.
Yeah.
And this relates not just to these screen injuries. Can you elaborate a little bit on ergonomics and how that impacts everyday life, really?
Oh, yeah. So I think with these repetitive injuries that we see sometimes, everything has a piece of the pie. I mean, we're not at work all day and we're not at home all day generally, unless you're working from home. But the person being able to perform their activities, whether it's work, whether it's their leisure skills, whether that's their daily activities, if they can reach what I use as neutral body positioning, which Dr. Papuchis, I think, alluded to, the 90-90-90 rule, that allows our bodies to work in the least stressful position. So at a computer, you want that eye level. You want your shoulders relaxed at your side, your elbows at about 90, your wrist straight, and not reaching out for that mouse, not reaching out for the keyboard. You want your feet supported by the floor. You want your back supported in a chair. But on the flip side, if you're working in the OR and you're transferring patients, you really have a position that you have to achieve with your teammates that are neutral body too, that you can perform your task with the least amount of stress as you possibly can.
So you do ergonomic assessments for staff at the hospital, and that's so important to keep our staff healthy and feeling good and avoiding those injuries. I know that you help get some people standing desks, things like that, but what are some of the most common repetition injuries in the hospital setting that might surprise people?
Our cardiovascular department, our ultrasound techs, they have, I think, one of the most demanding jobs, whether they are working in our fetal medicine with our moms that are pregnant, whether they are doing cardiovascular ultrasounds. They have to assume some of the most awkward positions for prolonged periods with high repetition that I've ever seen.
And that's a technology you wouldn't think of injuring the user, but I guess it makes sense.
Yeah, and they are an amazing group. They are highly educated on ergonomics, and they try to implement Any ergonomics that they can. There's actually a national organization that addresses ergonomics for this specific group. And
It's that big of a problem.
Can be, yes.
Well, I guess because they're reaching in awkward positions with their arms.
So shoulder injuries, elbows, and generally thumbs, because they are having to hold. And then also our sterile processing department. They are lifting all those heavy trays that come and go from the OR. And they have to clean. They have to, go into decontamination. They have to tear them down, build them up, lift them, wrap them, assemble them.
So really any job, you can find a way to focus on ergonomics. Because I think that that's an important point, is what these text injuries or screen time, what they really are is repetitive injuries. Someone is doing a motion too much that is wrong, or sitting at rest in a position that is wrong, correct?
Correct. And generally, injuries will occur when there's a combination of three things, and it's awkward positioning, repetition, and force. So if we can interrupt one of those, then we can reduce that potential for an injury. Now, we're never going to eliminate, but our goal is always to reduce and to improve.
How do you help patients who have one of these injuries avoid re-injuring something that is already maybe a little more fragile? Because re-injuring is, you can try to avoid the injury in the first place, but if you've already injured, you're at risk of re-injuring. So how do you help them avoid that?
Education, education, education. It's huge. And they may have to work on changing some habits. Maybe a lot of it is bad habits. And so again, it's through education. We hope that we can help change their environment. And, we may not be able to make it perfect, but if we can improve it and teach them positions to avoid, to, get up and move. Our bodies are made to move, not stay stationary. Then we can reduce their potential for re-injury.
And it should be mentioned that technology can be used for good in this case as well. Talk a little bit about that.
Oh, absolutely. So the majority of us, or many, we will have our smartwatches. It will alert us to stand. All the time, if I am performing an ergonomic assessment at a desk and someone sits for hours and hours on end, or they stand for hours and hours on end, I will have them set a timer on their phone so that it reminds them that you need to change position. I mean, our employees, they're engaged. They will sit there, they will get focused on a task, and they may not move for 3 hours.
So what is that perfect, how long do you let people go before that timer goes off? How often do you tell them to set that timer?
So what I recommend is that they change positions at least every hour. Now what that may mean is just standing up, or maybe you build in a task to go to the printer, or you drink a lot of water, you go to the restroom. If you have a sit-stand workstation, the recommendation is to stand about 15 minutes out of every hour. So just because you have a sit-stand workstation doesn't mean that you should stand all day long. You should alternate those movements.
Because you could be standing wrong as well in the incorrect position.
Right.
So
and standing for long periods is just as hard on the body as sitting all day long.
Okay, that's interesting. Is there anything else you want to add? I know we've touched on a lot of things, and it's really important that if patients are having these injuries or these concerns, they seek out PT/OT early, correct?
Correct. And I think the one piece that we don't really think about is we've talked everything about musculoskeletal here, but about the amount of emotional stress that goes with our workforce and how that can also impact our body. So when I'm doing ergonomic assessments, we also talk about that. And we tend to forget that piece.
Absolutely. Well, thank you so much, Regina, for
Thank
joining
you.
us today. And I want to thank Dr. Papuchis, who joined us earlier as well. If you liked this episode of HealthCasts, please like and comment and visit smh.com/podcast to listen to more experts like Regina and Dr. Papuchis talking about health issues which matter to you. And as always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.